So welcome back, everyone. This is going to be super interesting. I have with me Dr. T. Carmine Van Deven, and he is a DO, Doctor of Osteopathic Medicine. Welcome to the show. I want you to tell everybody a little bit about yourself and what you do, but also, what is a DO and what osteopathy is. We're live on Facebook, so I do want to say hi to everybody out there. Like us and follow us. We will share the show later on. So what, first of all, is a DO?
Hi, Carol. That's a great question, and I just want to say thank you for having me here today, first of all.
Thank you for being here.
Well, a DO is one of the two primary kinds of physicians that we have in the United States. There's the typical MDs, and we have DOs, and those are the only two physicians that have the full practice rights to diagnose and treat any condition, whether it's delivering your baby, taking care of you as your family medicine doctor, seeing you in the emergency room, doing your brain surgery, prescribing medicine, doing surgery, all of the above. Those are DOs and MDs.
Okay.
Now, the difference between a DO and an MD is that a DO also has an additional toolbox, let's say, in a philosophy, where we're looking at the patient as a whole person. We're looking at that unification of mind, body, and spirit. And we have a hands-on practice to help us diagnose and treat the condition that a patient may come to our door for help with.
Okay, now, the word osteopathy. I asked you before you came on, I said, I think I know that it's with bones, but you said it's much more than that, so explain that.
Sure. So the founder of osteopathic medicine, Dr. Andrew Taylor Still, he was an MD, and he officially introduced the profession in 1874. And his study of anatomy and physiology started with the bone. It's really a fascinating story that we don't have time for today, but he started to look at how he could understand the placement of the bones of the body as that relates to health, as that relates to the immune system, for example, and the heart and the lungs and the intestinal health. And it expanded from there to now, where osteopathy, as we know and practice it today, as he was also in his own evolution, expressed that through treating internal organs, treating blood vessels, the nervous system, every system of the body with our hands.
Before you came on, one of the things that you had mentioned to me was that you really just are here to educate the public about what you do. And you said it's not a lot of people do it, right?
That's the truth. DOs are in the minority of the physician population. As far as practicing physicians, we're probably around 11% of the physicians, MDs and DOs in the country. Mm-hmm. And we're about 25% of the medical student population, so it's a growing profession. And within that minority, there is a minority of individuals like myself who have really embraced osteopathy with our heart and soul. And so we provide this hands-on way of diagnosing and treating that we call osteopathic manipulative medicine. And so honestly, we're maybe around 10 to 15% of us still provide that hands-on care, where many other DOs are practicing very allopathically. They might prescribe your medicine, do your surgeries, take care of you in the hospital, but they may not be providing the hands-on treatments.
Okay, get that close to that mic for me. I do want to also ask you, because when you say hands-on, you really mean hands-on.
I do.
And I want you to explain sort of like what a treatment looks like, right? And then I want to really know what kind of conditions that that you can help with.
Sure, great question. So the treatment will look different for different individuals depending on our training, but the common foundation is that we screen the body, we get an evaluation of where is their motion present and where is their motion lacking, where is their restrictions. That helps us find a cause from at least an anatomical, mechanical function. And then treatment then could be very, very gentle. Oftentimes my patients don't even think I'm doing anything because they're just lying there, often even falling asleep on the table, as there's this potent shift through the body. The inherent healing mechanism of the body is able to rise in that moment as we're setting the stage and supporting that process.
Pretty cool.
Yes, there are other moments where something more direct is called for, so there might be more pressure, but it's always applied very safely, and it's very localized, so it's very intentional for exactly what we're doing in that moment to free up motion for the body.
And I also asked you before you came on as well, is it chiropractic? And what did you say?
No, it's not chiropractic, it preceded chiropractic.
So that's pretty interesting. So it's not. So whatever you're thinking out there, like me, you're wrong. Now you're located in North Scottsdale, and the phone number to call you is 610-345-7045. His website is drvandeven.com, and it's drvan.com. I do want to ask you this. So different types of not treatments, but different types of ailments that people come to you for.
Oh man, huge variety. I've treated newborns who I delivered myself in the hospital, just to kind of smooth out the process from their own trauma of delivery, to give them a clean start to their life. Those same children, if they're having trouble spitting up or they're inconsolable, there are ways we can work with their body, their anatomy, their autonomic nervous system to calm them and help restore health. Anyone with bumps or bruises, physical trauma is a real thing that changes anatomy, it changes physiology, so we can work with that. Any internal system, organ, autoimmune disease, seizures.
So it's not necessarily I have a sciatic nerve.
It's that and so much more.
And so much more.
Basically, anything in the body that has a structural component, a functional component, can be met with osteopathy to help it find health.
You authored a chapter in a book that's called The Sensitive Patient's Healing Guide. We only have a couple of minutes. Do you want to tell them what the chapter was a little bit about?
Sure. So the book is a compilation of different authors like myself who have an expertise in some way of contributing to the health of patients who are recovering from chronic illness, usually some very complex patients. And so the contribution that I made to this book was really focused on osteopathy, is looking at a structural component that sets someone up for a disease process, and how osteopathy can then enter into that as a way of finding cause on various dimensions that it might exist, and help the patient restore health by meeting it at that place and meeting these inherent healing forces that are always present.
You wanted to get this information out just to educate the public. You also said that you wanted to tell them that there are other places that they might be able to find other people that are, other doctors I should say, that are the DOs that work like you. And you said you wanted to give out a couple of websites, so hurry up and do that so I can get yours out too.
Sure. So one is Cranial Academy, cranialacademy.org, and the other is Traditional Osteopathy EDU.
EDU?
Treated.
It's okay. Here's the thing what you want to do. If you're interested in this type of a thing, it's very important that you give him a call. He'll talk to you. 610-345-7045. It's